Most of the patients who come to see us have been treated by their primary care physicians, often for years, and often don't achieve any lasting success. We begin with a conservative course of medical therapies to try to control symptoms, and for those patients who have evidence of chronic sinusitis, that's really when we begin to talk about options for surgery and looking at imaging studies to actually see what's happening in the sinuses. All of the sinus surgery that I do is done with 3D guidance, so we obtain a special kind of CAT scan, and we're able to image the actual CAT scan during the course of the surgery and be able to see exactly where our instruments are, which helps to keep those areas especially safe. And the really exciting thing for us in the last few years has been the advent of balloon sinuplasty, which is a minimally invasive technique to bring a sinus balloon into the space of the drainage passages of the sinus without cutting away any tissue and bone, and creating stable openings that will drain sinuses, allow air to get in and infection to get out. It's clearly more conservative. It's not a cutting technique. The risk of bleeding is smaller. The risk of complications in general are smaller because we're not cutting away tissue and bone. And the recovery, I think, is a little bit faster as well. About 85% of patients at 6 weeks after surgery are seeing dramatic reductions in the symptoms that they had. We've had a long history of very good success, better than national rates. Patients coming to Robert Wood Johnson can really feel confident that the surgery they're getting is in the hands of someone who's got long experience and good results. And ultimately, that's what gives people the confidence to be able to move forward, even those who are a little bit hesitant about surgery.